Hello, I'm with Silvia Binder and Rolf Binder, and we're going to talk about the OnDemid. Can you pronounce it for me?
Very nice. OnDemid.
OnDemid, okay.
It's Latin and stands for wave medicine.
Okay. And you're talking about a type of therapy that people need to know about. You're dealing with probably one of the leading causes or underlying causes of many type of chronic diseases. We call it inflammation. Can you help us first to explain what is inflammation and how do these energy medicine therapies work to help calm down the inflammation?
Well, inflammation is always involved, whether we feel it or not, whether we have symptoms or not. But it's so difficult, inflammation markers may show us that CRP levels are increased. Where is the inflammation sitting? So the beauty of the OnDemid is that I can, with the help of the biofeedback loop, tap into the unknown, the unseen. We can scan the patient's body with a handheld applicator, stimulating tissue, and when we come across an area that is of dysfunction, such as inflammation, an infectious process, scar tissue, and also very exciting is the realm of unresolved shock or trauma sitting as a memory on a cellular level. So we come across it, we don't know what it is, we don't have to label it. The patient's pulse feedback indicates the autonomic nervous system by an amplification increase that there is an area of any of those dysfunctions happening when the applicator scans throughout the body. So we then know where on the body the weakest links are sitting so that we can, within a minute or so, having isolated those areas, stimulate them therapeutically with those pulse-focused electromagnetic fields.
So, Dr. Binder, your training was principally in Germany and
in Europe.
In Europe, okay, and throughout. So, with your training, is it possible that someone could actually have wide-scale or pervasive inflammation and yet not have pain? Does that happen?
Oh, absolutely. Yeah. Happens all the time. We run around, going in and out of inflammation. And Johns Hopkins University did a study about 15 years ago where they say cancer is nothing else but going in and out of a stressed time in our lives, increasing or decreasing inflammation. I believe that, we say, okay, there's cancer in the body, but let's go one level down. That's the iceberg, right? Tip of the iceberg. We bring it one level down. What inflammation, what causes the inflammation? Oh, it's stress. Okay, let's dive into the water. What's stress? Why is there stress? Well, I believe in now becoming to more of a profound perspective of looking at our patients, look at ourselves even. Why are we stressed? Why are we not on target with ourselves? Why are we not happy with ourselves or the way that we lead our lives? So we got to touch on the emotions. And maybe also thinking about the spiritual connection. Because I believe that spirituality carries through the emotions and then it manifests throughout the physical body. So if we don't consider that we are living beings, being souls living in these temples of physiology, I think we're missing the picture. And I think it's time that we revisit ourselves and how we deal with patients, so that we capture them, we recognize them, not only by their symptoms and diseases and inflammation, but by bringing them back to who they truly can be. And by eliminating those roadblocks on the body, non-invasively, without labeling those roadblocks, I think patients will heal much faster and lastingly.
Rolf Binder, what gave you the idea, the technology? How did you come to the understanding that you could create a device that that could actually calm down inflammation and target it? And tell me a little bit, between the two of you, how does it work within the body? Because the body has tremendous amounts of energy, but when that energy level flow is somehow interrupted, what role or how are you looking at this device to intervene and help people?
Exactly, your question was the reason or the source which fueled my vision. So I wanted to create a device which combines a good physical stimulation and also to cure medication with the patient. So I had my experience previously, before I started my company, by developing holistic approaches in devices, but I want to do more. I saw the approaches before, they had not the right explanations for the medical world we live in. So my goal was to find a method which is better in explanation. So it has to be a very simple physical explanation to it, and it has also to have the same qualities of communication with the patient in order to find what we need to find. So looking at chronic disease, if you have a chronic disease, the reason for a chronic disease, in my opinion, is there's something hiding. Injury, a trauma, or something like that. And because this is hiding, the body is not able to heal. Now, the advantage now in developing a device is to lay the foundation to be able to stimulate, maybe locally, like you would do in acupuncture or in other targeted approaches, and also being able to have a feedback, to have a yes or no response from the patient. So
Yes or no within their body,
Yes.
feeding back to the machine in the
Yes.
unit, not they're saying, yes, no, it worked.
exactly,
Right?
that's the point.
Yeah, and whereas acupuncture doesn't give you feedback. I mean, you're doing a treatment and maybe getting a result, but now your device adjusts to the feedback?
The practitioner is the mediator.
Yes.
He is in the loop. You could say three parties. It's the device, the treatment, the stimulation. It's the patient receiving the treatment, and it's the practitioner feeling the patient's pulse, but then correcting the device settings or
Very good.
placing the applicator.
I understand. Very good. Have you utilized the device for yourself, and what was the outcome, and what did you use it for?
Of course, I used it a lot.
I figured so. That's why I asked.
I'm doing it for 20 years now.
Yes.
So I had certain needs, that's one thing, but I also try to experiment. What I like most is, in any case of injury, in German you would say it's a Hausmittel, it's the house remedy. So you go to the device and you treat your injury, and you will be amazed how fast the injury is healing compared to be not treated.
Okay.
So, such as the
Yeah,
cut.
a cut, yes. Normally if you cut yourself, the wound gets hot, red,
Yes.
inflamed,
Yes.
and then it takes days, depending what you do with the wound. And so if you stimulate the wound, it will not get hot, it will not swell,
Oh.
and
Close up
it
very
will
quickly.
close up very quickly.
Very good. Wow. Dr. Silvia Binder, for yourself,
Yes.
have you noticed with treatments on yourself, before we get to talking about the type of clients that benefit, but what have you experienced with it?
I started experiencing with it 13 years ago because
Okay.
this is a second marriage, and we sort of bonded because of OnDemand and OnDemand saving my son from open heart surgery.
Wow.
So that was a huge experience, touching my life.
Yes.
But for myself, I was playing with myself in the beginning days. I couldn't hear out of my left ear, for example. And the ENT physician said, "Oh, your hearing is perfect," which could not be because I couldn't hear when I had the phone at my left ear. So when I scanned, I was treating myself, sitting on the couch comfortably. A program that showed up for me through the biofeedback loop was a scar removal, and so dysfunction of scar. And so I scanned down along my body. I have many scars. I had a motorcycle accident. So I scanned down. I'm on the arch of my foot, staying there. Suddenly my ear gets hot and pops. Who would have thought to treat the foot in order to open up the ear? 2 days later, my daughter says, "Mommy, your scar is open and it's bleeding. It had been closed for 15 years. So
Wow.
talk about detoxification. And my ear has been good ever since. So that
Wow.
was quite an interesting experience too.
So how, since the body generates so much electric energy, Discovery Journal states that the body generates 15 million volts of energy per cubic millimeter, right? And something like approaching 50 million volts in the mitochondria. Where does the ornament play a role in energy medicine? Does it duplicate the energy? Is it a different kind of energy? Are you able to figure out what the energy source is? Because this is an energy medicine device to help people.
That's correct, but we're not adding energy. That's important.
Okay.
We are redistributing the energy.
Okay.
So we're causing a vibration on a cellular level, just like an MRI technology.
Okay.
When you're being put into the MRI device, you hear the pulsation. It tuckers. So that's the tuk, tuk, tuk. That's the pulsed electromagnetic field.
Right.
Very similar to on-the-med. However, here the purpose is diagnostics. So the field intensity is between 2 to 3 Tesla, and because the whole body is exposed to the field versus the on-the-med just having a few applicators sitting in a focused way, the difference is that the MRIs are millions times stronger than the on-the-med.
I see.
So we're not adding on-the-med, we're helping to redistribute. So if there is heat, if there's a wound that was more heat or an inflammation with heat, we wouldn't want to add more heat.
Right.
But we would want, of course, immune response to distribute, to help detoxify the area and help stimulate lymphatic flow, to carry out the toxins, the waste, also fluids that are in excess. So it's not from the perspective of adding a voltage, because it's not voltage, it's pulsed electromagnetic fields, which is the language of our cells. We're electromagnetic beings.
Absolutely.
But maybe Rolf has you want to say something too?
Yeah, important is we are creating movement. We don't want to add energy. So each impulse is inducing a tiny circulating current in the area where we point the applicator to. And this is very important in treating sheltered areas, in treating scars, dense tissue, or inflamed areas.
Wounds, infections.
Wounds and infections. And the tiny currents has the advantage that it is local, working only locally. It is bound to the place we put the applicator to, we point it to, and so compared to a regular current treatment, it's not flowing from one pole to another. It's just circulating according to the magnetic field.
Wow. So, have the two of you seen conditions that you thought you weren't sure whether the treatment would work, and yet you saw results? Is that part of the pioneering work? The device has been around since what year?
1995.
1995?
Yeah.
20 years already.
Yeah.
But it's so true, because you never know, and there's never any promise. You never know how far you can go until you
Right.
try.
Yeah.
But we've found that the biggest population that is drawn in and helped the most are Lyme patients.
Oh, tell me about that, because I work with some doctors that actively are learning what to do to try and help Lyme patients, because it's a surprisingly high number of people that have the problem, right?
Absolutely, it's a pandemic.
Yeah.
And it's in areas where ticks really don't survive, so the theory on the tick, I mean, there's so much more to that,
Mhm.
and we don't really know why there is Lyme disease or the symptoms thereof.
There's
So
a type of
antibiotic-
spirochete or something
That's
within
what-
the system,
That
right?
is correct.
Yeah, and I've
Yes.
seen it under a microscope.
Mhm,
It's amazing. I mean, wow, there it is. And you actually can see it in other tissues of the body
That's
as well,
right.
right?
Anywhere
Yeah.
can hide very well.
Yep.
And the bacteria is Borrelia burgdorferi.
Mm-hmm.
But the illusion would be that I try to treat Borrelia and hope that the Lyme symptoms would fade away. There's not just only bacteria involvement. There's so much more involvement. So with the Ondamed, we have a module that focuses in on the stimulation of microbes, bacteria, virus, parasites, fungal involvement. And it will be the pulsus autonomic nervous system that suggests to the practitioner which of the frequencies is in the forefront. It could be a fungal involvement, a liver parasite, and not the spirochete. You've got to go layer by layer if you want to make a big impact on your health.